assessment. So I'm going to ask him to do pull-ups. We're going to go overhand position. And as you're ready, I'm going to ask you to perform pull-ups. What we're looking here is kind of his ability to actually, one, perform the pull-up, and two, we're going to look at any compensations that he may have. So whether he's swaying, swinging, whether he's lifting his legs up, looking at his scapular motion as he goes up, neck, whether it goes forward, backwards, and for his ability to clear the chin over the hands. Okay, thank you, Brett. For patients that aren't able to perform a pull-up, another thing that you can do is a hang test. You can have them sit there and just assume a chin-up and actually have them hang and just do a timing assessment. For him, this is kind of one of our evaluation assessments that I like to use for overhead. Athletes, once they've cleared any clearing test, make sure that there's no pain. So like our FMS shoulder mobility test. Next thing we're going to do is a prone lift-off exercise. I'm going to have the patient lay prone with a PVC pipe over his head, and we're going to ask him to perform 3 repetitions. And to instruct them in this exercise, they're going to keep their necks down, hands over their head, and you're going to ask them to do 3 repetitions, extending their arm as far overhead as they can while pulling their scaps down and in. You're looking for compensations at the lumbar spine, at the neck, and you're looking to see how symmetrical the movement is with their overhead extension. Flexion. We're looking at the scap movement here. He's got no movement at the lumbar spine, and we're going to look to see how symmetrical his arm movement is. Next thing we're going to have him do is a kettlebell pull through. This is a good exercise that combines shoulder work as well as core stability. So here he's going to assume a 4-point stance. Okay. Ideally, we'd like their feet to be as close together as possible, understanding that the base of support, the wider it is, the easier the exercise is going to be. So to limit further compensations, I'm going to have him take your feet just a little bit wider today, Brent. Good. And then what he's going to do is there's a kettlebell on the other side of him. He's going to actually reach under, pull through, and set it down on the other side. Okay, the focus of this, what we really want to do is, one, you can see the core moving side to side. We really want him to lock in and stay tight there. So good abdominal bracing, good breathing. He's not holding his breath. And we also want to look at how the serratus works here. Okay, we want to look at that scap and make sure there's not a lot of winging as he's pulling through with that exercise.
If this was correct, I'd really like to see his body not moving side to side and notice the scapular winging. I really want that scapula packed and set as he pulls the kettlebell through.
Here we have him in the half kneeling stance, so we're going to do an exercise that we call the snow angel. This is a good exercise you can actually do in any posture, so half kneeling, kneeling, standing, split stance, all works great for this exercise. So for him, first thing I want to do is just kind of see he's got some little bit of excessive lumbar lordosis here. So I'm actually going to kind of set him into position with his breath. So right on, actually have you take a breath in through your nose, out through your mouth. I want you to bring those ribs down and pelvis kind of together. Lock that in there. Good. Let your neck move there. Just work your spine. Take another breath for me in that position. Good. So we corrected a little bit of this posture here. So I'm asking him to maintain this posture, resume his normal breathing, and perform 3 repetitions of the snow angel exercise. Okay? So here he's going to pull back, arm overhead, and he's going to resume the starting position. So we like to see 2 seconds up, 2 seconds down. We're looking at scapular motion. We're looking for any neck compensations. We're looking for him to lose his core stability. Looking for him to lose his balance. We can alter his base of support to make this more challenging if need be. Here we'll look at a sport-specific pull exercise. So we're going to start off here. 3 reps just working on taking a weighted ball through external rotation. Assume position. Again, we want good starting position here. Breath in. Good position. Good. Lock in. Abdominal bracing. Okay, and 3 repetitions. want to make this a little bit more sport specific, a little bit more challenging. I can take this into an eccentric exercise that's going to mimic the D2 flexion extension patterns. Right, that's our overhead toss. Okay. What I like to make sure when I'm performing this exercise is that I actually throw it out in front of them and have them catch it as they go, not catch it and then bring the arm through. So I want this to be as fluid as possible. This is a great exercise that you can do for your overhead athletes. Here we're going to look at another pulling exercise for the upper extremity called a lawnmower. I like to start this exercise. There's still a standing exercise, but I've got a base of support here. With the elbow resting on the knee. I want a good neutral spine, so bring your knee up off the ground. Okay? Good neutral spine here. Okay? And he's going to pull with the kettlebell and get some thoracic rotation as well. Okay? Let's do 3 reps in that position. Okay, I don't want any compensations where his lower back begins to arch. I don't want him losing his balance. His head will follow the kettlebell, which is fine. We do want that. Good, so let's make this a little more challenging. You can go ahead and take your knee, your arm off your knee. Good, give me a good starting position. Bring your weight up just a little bit. Good. Good neutral spine. And perform the exercise now. Next thing we're going to look at is a scap stability. We're going to add in some thoracic rotation to this exercise. Work on some thoracic mobility as well. One of the things as therapists and clinicians that we tend to do is stay sagittal plane dominant, so I want to make sure that we integrate some other planes of motion as we go through here. So for him, we've got some resistance tubing in both hands. He's got good resistance on it. Good standing posture, good base of support. Scap is locked in. Normal breathing as you resume this. So what we're going to do for this repetition, left arm is going to stay locked. He's going to keep his right arm straight and roll through some rotation. Okay? Good. Just keep that left arm nice and locked. And you squeeze his shoulder blades as he goes back down and in. Good. We're okay if the neck follows the arm in this exercise. We actually would prefer that. Here we're going to look at a variation for the hamstring curl. I've got him on a Sorinex glute ham roller. This is a new piece of rehab equipment that I've recently found and started incorporating into my rehabs. It's a great transition piece to get them from the bridging position into an exercise such as like a Swiss ball curl. So for him, he's going to put his feet on the roller. We're going to bridge. Good. We want good neutral spine. I don't want any flaring of the legs. And we'll check. Perform 3 repetitions here. He's going to pull all the way under his butt, all the way back out. He's maintaining a good neutral spine, good breath. You can see a good thing with this piece of equipment versus something like the Swiss ball is you're getting much more range of motion and a lot of hamstring activation. Another thing we can do to challenge him, there's 3 bars on here, and so I can actually take some resistance tubing, add tubing to this to add resistance, and make it a little bit more challenging. As we progress from the Sorinex glute ham roller exercise, we're going to put them onto the Swiss ball. We've changed our base of support here. We've altered the task. We're going to make this a little more challenging for him as a patient. So he's going to perform this exercise very similar to what he did on the roller. Okay, so you're going to assume the starting position. Good. Neutral spine is what we're looking for. And he's going to perform 3 roll-ups. Pull up. Good. He's maintaining normal breathing as he performs this exercise. We're trying to keep that spine in neutral as much as we can. We got a little bit of compensation coming up here, a little bit of flaring of the legs as we can see. But again, this is an extremely challenging exercise for the core as well as the hamstring and glutes. Good. We can relax if we want to. We can make this easier by adding the base of support. We can make this wider, give him a little bit more stability as he performs it. So go ahead and perform one more rep for us. See if that changes it. A little easier?
Yep, yep.
So I should have given you that one first. Here we've got the patient again in a quadruped position. I'm going to sit you back here a little bit. Bring your hands back just a touch. Good. So we've got a good stable base here. Neutral spine, neutral neck. Have you take a breath and just get in position here. Bring those ribs down just a little bit. Good. Okay, make sure we're good neutral spine there. And then what we're going to actually work on here is just some single leg glute extension. So he's going to take his right leg as he's pushing into the floor with his left and right arms and his left knee. And then he's going to extend back, come back forward. I want that nice and straight in the sagittal plane. Good strong base here, so good abdominal bracing breath. Come back. I don't want any compensation of him rolling over. We've got a little bit here, so we would kind of cue that. So lock in again for me. Good. Come back. A good progression to that is to obviously move away and start incorporating some of the upper extremity a little bit more. We're getting some of that with the resistance band, having to hold there in an isometric position and to push it to the floor. So to challenge that, we're just going to do an alternating pattern. So here he'll extend and flex his arm at the same time. Come back through, lock in there tight for me. Good. Through. Breath. Get your arm up just a little higher in the next rep. Good. So again, compensations, we're looking and really challenging core stability here. I'm looking at his motion through the sagittal plane, making sure we're not compensating, rotating, rolling over, losing our core, making sure he's not holding his breath. Neck doesn't flex or extend, doesn't lose his balance. Next, we're going to perform a single leg RDL. So we're going to have him start in the standing position. We're going to have a bar in his hand for the video. This is just a PVC pipe, but we should add a weighted bar, kettlebell, dumbbell, anything that you want for resistance would be a great supplement for this. Okay, so we're going to do the right leg on the ground, and you're going to take your left leg back as you reach down with the bar. Okay. What we're doing here is instructing the patient to reach down. He's going to kick his left leg back. I'd like for his spine to remain neutral and parallel with his leg. I don't want any rotation of the pelvis. You can't really see from that angle in the video, but he does kind of roll towards the right as he goes. These are a couple of very standard compensations that we tend to see with patients. So how we tend to correct that is you're going to take the bar here. I'm actually going to put this on your foot. Okay? I'm going to have you just kind of step right there. So I'm going to bring it down just a little bit there. Okay? And now I want you to reach with your right arm and do the same exercise that we just did. Okay? Perform 3 repetitions. You can see here by adding some feedback, we fixed the neutral spine. We've still got a little rolling in the video, so obviously for this patient, we'd want to work on some core stability, probably in a different position before we got him into the standing position. Here we're going to do a standing single leg glute exercise. What we're going to do, I've got TheraBand tubing around his knees. I'm going to challenge him and put him in a single leg stance again. We're actually going to work on some push-pull together here, okay? So single leg stance on the right. Good. And you want to start performing the exercise, kick-throughs. Good. What we want to make sure here is that the hand movement and leg movement work together to simulate normal gait. One of the things, the compensations that we tend to see is the leg that they're kicking back, they tend to like to just move that arm with it, but that's not functional gait training, so we